everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Nursemercymary, popularly known as the nurse with the difference, and I make learning easy and accessible for students. Today we're going to be talking about pressure sore. What is pressure sore? What are the causes of pressure sore? What are the predisposing factors of pressure sore? What are the parts liable to develop pressure sore? What are the various stages of pressure sore? And also, what are the prevention of pressure sore? These are likely questions in our nursing and midwifery council exams. By the end of this class, you should be able to answer these questions. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about pressure sore. What is pressure sore? Pressure sore is also known as decubitus ulcer or bed sore. Pressure sore is also known as decubitus ulcer or bed sore. Pressure sores are injuries to the skin and underlying tissues. They are injuries to the skin and underlying tissue, resulting from prolonged pressure on the skin. Resulting from what? Prolonged pressure on the skin. Then that takes us to causes of pressure sore. The first we have here is pressure. Pressure. When there is prolonged pressure on the skin, when there is prolonged force on the skin, it can result in what? Decubitus ulcer. Then the other one we have here is friction. Friction is also another cause of pressure ulcer. For example, when giving bedpan, every time you want to give bedpan, you are not giving this bedpan properly, it causes a friction between the patient buttocks and the bedpan. It can actually result in what? Pressure ulcer. Then the other one is shearing force, similar to friction. They will also have moisture. Wet surfaces can result in pressure sore. Then that takes us to the predisposing factors of pressure sore. Predisposing factor of pressure sore. The first we have is poor nutritional status. Poor what? Poor nutritional status. When a patient is not well fed, when an individual is not well fed, definitely the individual is going to be slim like me or slimmer than me, and these surfaces are already prone to what? Decubitus ulcer, especially when they are lying down for a prolonged period of time. Then the other one we have here is aging. Aging. You will agree with me that old people, they hardly move about. They are always in one strategic location. Is either they are lying down or they are sitting down. And come to think of it, when they are sick, it becomes worsened. So aging is also one of the causes of decubitus ulcer. And you know, the old people, their skin are no longer durable, elastic like our young fresh skin. Then the other we have is obesity. The fat people, you know, they are very, very fat. So even moving about is a problem. So they prefer sitting down. They prefer lying down because they can't really carry themselves out. They can't really move about like the normal slim people like us that can move about. So obesity is one of the major causes, is one of the predisposing factors, of decubitus ulcer. And imagine an obese patient or a very, very, very fat patient in your ward. Turning that patient regularly will be a very, very difficult task also. Then the other one we have is edema, anemia, poor hygiene, and immobility. Immobility cuts across being obese, cuts across aging. So all these factors here are predisposing factor towards decubitus ulcer or pressure sore. Remember, the causes are pressure, friction, shearing forces, and moisture. Then the predisposing factors are poor nutritional status, aging, obesity, edema, anemia, poor hygiene, and immobility. Then that takes us to the parts liable to develop pressure sore. The first we have on the board is the scapula. The scapula, this shoulder blade, the scapula is liable to develop pressure sore. So you have to treat those pressure areas as a nurse. Then the other is the elbow. This elbow, the elbows are liable to develop pressure sore. The sacrum here, the sacrum are liable to develop pressure sore. We have the heels, that's the foot area, that heels. The heels are liable to develop pressure sore. We have the occiput, which is this place, this head when lying down. So the occiput are liable to develop what? Pressure sore. We have the hips and we have the inner knees. These are the parts that are liable to what? Develop pressure sore. The scapula, the elbows, the sacrum, the heels, the occiput, the hips, and the inner knee. That takes us to the stages of pressure sore. What are the stages of pressure sore? The first stage, there are actually 4 stages of pressure sore. The first stage is stage 1, stage 2, stage 3, just as the name implies. So the first stage is actually the stage 1. In stage 1, what is being affected is the upper layer. You see this, the surface of the skin. It has not gotten into the dermis, deep down into the dermis. It's just on the surface of the skin. Then in stage 2, it dips below the dermis. It has gotten, it dips, it gets to the dermis, the epidermis, sorry for that. It digs deep and it has gotten into where? The dermis. That's the first layer of the skin. Then in stage 3, it has gotten to the second layer of the skin, which is the dermis. In stage 3, it has gotten into what? The second layer of the skin, which is the dermis. And there's a possibility it's going to get to the dermis if not treated. So when it's treated, it gets to stage 4. In stage 4, it has gotten to the dermis, the muscles, the ligaments, and even the bone. Here, see, let me go over it again. In stage 1, it's the upper layer of the skin. You get? In stage 2, it has dug deep into the skin. It has gotten into the epidermis and is getting into the dermis. In stage 3, it has gotten into the dermis, it's going to the subcutaneous tissue. Then in stage 4, it has passed through the epidermis, it has passed through the dermis, it has gotten into the subcutaneous tissues, it has gotten into the muscles, it has gotten into the bones. So that are the first stage, of pressure sore. Over it again. Stage 1, upper layer. Stage 2, the epidermis. Stage 3, it has gotten to the dermis, going to the subcutaneous tissues. Then stage 4, it has gotten to the bones, it has gotten to the ligaments, and it has gotten to the various muscles. So as a nurse, it's our responsibility to prevent ulcer from graduating from stage 1 to stage 2 to stage 3 to stage 4. That is why we have to treat pressure areas regularly. That is why we have to prevent it, because at this stage 4, there's pus coming out, there's signs of infection. This patient is likely going to get down with fever. So the patient has running temperature, there's odor coming out from that spot. So that is why it's our role as a nurse to prevent this patient from developing pressure sore. The big question is, how do I prevent pressure sore? This is a common question in our nursing and midwifery council exam. How do we prevent pressure sore? Now we're going to be talking about the prevention of pressure ulcers. What are the prevention? How do we prevent it as a nurse? The first one we have here is inspect all areas at least twice a day. The areas we are talking about is the parts that are liable to develop pressure sore. So you have to inspect all areas at least twice a day. Then the second is change position as often as possible by encouraging patients to move. Madam, shift, change. Encourage them to change position regularly so there will not be but prolonged pressure. Then the other one is turn helpless patients frequently. Not everybody can turn themselves, especially the unconscious patients. So you have to what? You have to turn the patients frequently, the helpless patients frequently. You can call for an assistance to do so if you can't do it alone. Then the other one is keep bed free from irritating elements such as your moisture, wrinkles, crumbles. So you have to keep the bed linen smooth. You avoid what? Wrinkles on the bed. Avoid any small sand or things like that that are likely going to drop on the bed. Avoid them. Keep the bed free from wrinkles. Keep the bed free from sand. Keep the bed smooth. Then the other is careful giving and removing of bedpan. When giving bedpan to your patients, you have to do it carefully to avoid unnecessary friction that is likely going to cause pressure sore. Then the other one is no long nails or jewelry should be worn by a nurse. When you are wearing long nails, in the process of moving your patient, in the process of giving bedpan, in the process of taking care of your patient, there's a possibility you're going to scratch the surface. You're going to apply a shearing force on the surface that is likely going to result in what? Pressure ulcer. Keep skin dry and free from discharge and excretion. Keep skin dry. Then the other one is use bed appliances such as airings. We have air bed, we have water bed. You have to use that so that the patient will not develop pressure ulcer. Then promote circulation by massaging. Most times I encourage my patients, or I do it myself, I massage the edges, those areas that are likely going to develop pressure sore. You get, I try as much as possible to massage it. With a Vaseline, you massage circulation to increase circulation. Then sometimes I had a patient that was having a pressure ulcer around the breast area because there was pressure. The woman had breast cancer, so I had to massage it after wound dressing in that area, the area that's liable to develop it. So you have to massage that area. Then the other one is pay attention to nutritional and fluid needs. Pay attention to what nutritional and fluid needs, so that this patient will not be emaciated. And you know, patients that are emaciated are prone to what? Pressure ulcer. Then a good hygiene, very important. Never allow patients to lie on the wet bed. Remember, we said that one of the causes of pressure ulcer is what? Moisture. So you don't allow your patient to lie on a wet bed linen, on a wet bed. It's going to predispose that patient towards pressure ulcer. Then the last one we have is active and passive range of exercise. Patients are allowed or are encouraged to carry active or passive range of exercise. Active exercise is the one that this patient does on his or her own, while the passive exercise is the one you help the patient do. So you encourage the patient to do so. That is all for today. That is all we have to say about pressure ulcer. If you have a question, kindly drop on the comment section. If you have anything to say, suggestion, feel free to drop on the comment section. Don't forget to like, don't forget to subscribe, and don't forget to turn on the notification button so you don't miss out. Thank you very much, and have a wonderful day ahead.